Okay.
We're back.
We're back.
Hello.
Or maybe we're not back. Maybe you're seeing us for the first time. You know, technology. Anyway, welcome. I'm Teri Jaklin from the MS Path, and I'm super excited today to be here with Marisol.
Thank you.
You know, things are in healthcare are changing such as they haven't in the last 10 years. Like everything is literally falling over each other itself with new research on old stuff that as naturopathic doctors, we're both familiar with. But today we're going to talk about castor oil because that's another area where we've been dedicated to it for
years, like combined 25 years of castor oil usage, right?
Yeah. And now the evidence base is catching up to that too. So it's such an important part of healing, right? And you know, my audience is predominantly people with MS, but like everybody really.
Oh,
right?
Absolutely. Castor oil is one of those tools that is the foundation. You know, if you look at therapeutic order, so, you know, of course, we always start with diet, nutrition, exercise, trying to move. But then after that, there's something that we need to do is we need to engage the healing power of nature. Because we're prescribing probiotics, supplements, all these things. But if we don't engage the healing power of nature, how are those probiotics and supplements going to work?
Of course. And if the body is just so
not
sick,
ready.
Like the fundamental functions of the body, right?
They can't flow properly, right? And that's the energetic aspect of it of our medicine. And there's three things that you and I know well that engage that natural healing power. And number one, it's castor oil packs, right? Which is why we were just talking before we went live, right?
Yeah.
Every patient.
Since my very first patient 16 years ago.
Yeah, me too. And every patient, every single visit, if they come back and they haven't done their castor oil pack, I tell them, that's the most important thing I prescribe.
So if any of you are my patients out there and you're not doing your castor oil pack regularly, get it going again.
Yes.
You might get away with it from me. You'll never get it from me. Ever.
And the thing is the other two things that engage that healing power of nature, and this is actually in a really good article that was just released in Naturopathic Doctor News and Reviews about the therapeutic order. And there you can see the pyramid. The other two things that engage that therapeutic order are acupuncture, which is fabulous, which we'll prescribe to patients, but you have to go into the clinic to get it done.
Yeah, exactly.
Right? Yeah. And then classical homeopathy. Now, to really do classical homeopathy
hard.
So difficult,
nowadays,
right?
Yeah.
Yes, because our bodies and our pictures are so muddled with environmental toxicity.
So mucky,
right?
Yeah. And then even just the concept of constitutional homeopathy for the patient, right?
Right.
It's sort of like, okay, here's a remedy. Now I want you to go away and wait and see if anything changes. And people just are so disconnected from themselves that they're not in tune with those subtle changes that happen. Right?
So then castor oil
makes more sense.
Yeah, it's a treatment that's been done. If you actually look back to records, we're not talking like a century. We're talking like before Christ kind of thing.
Right.
Like this is the oil that anointed in the Bible, right? So it's the oil that Jesus Christ would use on people who were sick.
Right.
It's the oil that was used to anoint the clergy. So as they elevated into different areas, the oil that was used to anoint the kings and queens.
Right.
One of the reasons why I call myself the Queen of Thrones.
Right.
It was used by Egyptians even further back.
Absolutely. They found it in Cleopatra's pyramid.
Great. And for Egyptians, they used it as an embalming liquid and also to beautify because
Cleopatra also dropped it in her eyes every night.
Right. And me and Jack, we love Teri, we absolutely love like castor oil in the eye and because there's so many benefits to it, right?
Absolutely.
And the research is showing that.
And so dry eye, blepharospasm, blepharitis, pink eye, all of those things.
All those conditions. And now there's research is actually showing that it is super valuable. We were just talking earlier on, you know, they did a study using the lenses of animals and to see how much the glutathione, which is a natural superpower antioxidant in the human body that will clear anything out, heavy metals, toxicity. And they saw that when the lens of the eye was placed in a solution with castor oil, it worked better even than a solution that which contained glutathione to increase the level of glutathione in the eye.
And glutathione, for those of you who don't know, is the master antioxidant. So it recycles itself, it recycles other antioxidants, and of course we know that the process of aging, disease, everything has to do with oxidative damage.
Yeah,
right?
And especially when it comes to MS and, you know, like neurological conditions, glutathione will preserve those the neurological tissues more than anything.
Yeah,
so there's so few things that augment your natural glutathione.
Exactly.
You know, there is a whey protein, but I don't prescribe whey protein. Because it's no way to whey, because it's dairy, right? Yeah. And then the other thing is an N-acetylcysteine, right, which is a supplement that we'll use. We'll have to combine it with magnesium. Yeah. But as you know, magnesium in MS patients, for sure, it could be one of it's one of the hardest things to keep high. Yeah. Right? Exactly. Because magnesium gets depleted so quickly with detox. Exactly. And then after that, IV glutathione. Yeah. So really, not everyone can access.
Well, not everybody can access that, but what's the half-life of that, right?
Right.
It's gone.
Boom. As fast as you take it in, it's gone, right? Rooibos tea is one of the other ones that we prescribe too. So, you know, castor oil, taking that home, doing a pack, that can really help. And that's one of the reasons why we recommend it so much, right? Yeah.
So the question people always ask me when I go through my little thing, and I've got a little video on my website that is a, you know, DIY castor oil pack. But they say to me, what does this do for me?
Yeah.
So I'm going to tell you what I tell them.
Perfect.
And you can tell me if I should be telling them more.
I love it. That sounds great. Yeah. Interactive.
So I tell them. So first of all, I always talk to my patients about the liver lymphatic pump.
Yeah.
And that just keeping the body clean and keeping the immune system balanced and stable and all of that kind of stuff. Yeah. So I tell them by putting it in the center of their abdomen, first of all, it's directly taking inflammation down through their gut.
Number one, for sure. Yeah.
Guilty by association is the huge organ that is the liver.
Yeah.
Right.
Yeah.
So it's mobilizing the liver. So, and I tell people the liver does 400 things a second in our body. So we always want to make sure that our liver is super, super healthy.
And working and pumping well. And
Then the vagus nerve, which starts at the base of the spine and runs up to the brain, which switches us between the sympathetic nervous system and the parasympathetic, or the stress response and the relaxation response, is activated by the castor oil pack.
By the pack. You can't just do the oil on the body.
Exactly.
And that, Teri, I believe it, for me, is the most important action of the castor oil pack.
Right.
Is that, you know, somatic, so your nerves on your skin where you put your pack, stimulates the vagus nerve, the ganglion, stimulates all the organs in the abdomen area to, you know, release their juices, the digestive enzymes, the liver.
Think about everything that's in there, right?
Yeah.
They don't call them vital organs for
no
nothing,
reason.
Right?
Yeah, it's so true. It's so true.
Yeah.
So that, and to me, like, your liver can't cleanse, your digestive tract can't go into the relaxed state of peristalsis where it's moving out all the toxic matter if you don't put your body into that relaxed state. And to me, like, in our society, we're all running in sympathetic mode. Right?
All the time.
Constantly.
All the time. Not you.
No, I do too. That's why I need to do castor oil packs, because that's what that was to me. Like, I got so sick, Teri, in naturopathic school in my 3rd year. And that's where I created my first castor oil pack. I was so sick. I got mono, environmental toxicity, and I had to take a semester off of school. And that, for me, being an energizer bunny that I am, was devastating, right? It was like, here I am, kind of fatigued. I can't get out of bed.
Right.
And so, but I was eating right. I was exercising right. I was taking all the supplements. But the thing that I was missing
was that foundational stuff we were talking about.
Exactly. I was not engaging the healing power of nature, which is putting your body into that relaxed state.
Exactly. And everything works better then.
And all my supplements started working better. And all my practices were working better.
Are you listening to this, folks?
Right?
This is the queen
here.
So
this is why I'm on a mission now, Teri, because you know, like, I realize that, you know, the thousands of dollars that each of us are spending on our health, right? We all do it. Like,
thousands of dollars a month,
right? On supplements, on good food, organic food, all that amazingness, you know, great practitioners, which you need a good guide. You can't do these things on your own. And then, you know, if you really want to maximize those things and really have them work and engage them, we got to be all doing castor oil packs regularly. and retraining our parasympathetic tone. That's the key, right?
Exactly.
Yeah.
And that includes constipation, which is so prevalent in people with MS, right?
Of course, yeah. And then,
or even diarrhea.
Absolutely.
You know what I mean?
And that's a question I get a lot, and you probably get that too, is that, if I have diarrhea or loose stools, will castor oil packs make me go more?
Right. No.
I love it. No.
Because it regulates.
That's right. It absolutely regulates. And there's the newest research, and those are, I believe, are your talking points on castor oil, right? That's what you tell your patients, the most important. You got them on the thing. But there's the newest research that has come out. So what we talked about, the glutathione.
Right.
It's highly likely, if castor oil is improving glutathione in the eye lens, it's highly likely that it's doing that with all human cells.
Well, think about the liver.
Right. The hub of glutathione
production.
The liver and the mucous membrane of the gut. Those are the hubs of glutathione, right? Yeah. So
and secretory IgA and
right.
So I have a question.
Yeah.
And this is totally hypothetical.
Yeah,
so
love it.
I just am back from the IFM conference.
Love it. Yeah, great.
Which was all about autoimmunity, right?
Of course. Perfect.
And Alessio Fasano, who I've got like this total doctor crush on.
Woo! I have so many of them.
Anyway, he's the international leading researcher in non-celiac gluten sensitivity, and he said it takes 30 to 60 seconds for that zonulin to be busted down to activate a leaky gut when we eat gluten, right?
Wow. Yeah.
And it takes 6 months to get 75% of the integrity back in the gut. So 6 months to not even get 100% back.
Yeah.
So,
so and
I have castor oil. Do it for zonulin.
Well, this is the thing.
Question,
this is the thing, and this is hypothetical, but I can tell you this from studies we've done in our clinic, and I know a lot of IFM doctors. Not a lot are familiar with castor oil, right? They don't because this is old nature cure.
Yeah.
So my philosophy is that castor oil packs will rapidly, because of the parasympathetic switch.
Yeah.
And there's really good evidence that it talks about when you're in the sympathetic stress state, you have a leaky gut because the membrane of the gut is more permeable.
Right. So when you're in a parasympathetic state.
It's more permeable in a stress state.
Yes.
And then when you put it into the parasympathetic, you'll close up the gaps. Right. So I think that'll help the zonulin.
And I think it's important to say here, when we talk sympathetic and parasympathetic, the sympathetic, think of the S for stress, and parasympathetic is the relaxation state. And those are equal and opposite fields of the autonomic nervous system. The sympathetic or stress response is intended to get you out of harm's way, so a life or death situation. Yeah. And the parasympathetic is what happens when you survive. Obviously, if you die, you don't.
Yeah, you don't. Well, you get really rested.
Exactly.
Yeah.
But I hear Lorraine. You're so funny. That's me right now.
Oh, I love it. Lorraine, castor oil packs.
Hi, Elena. Hi, Missy. Hi, Matt.
Hi, everybody. Good to see you. Thank you. And hope you're enjoying it.
Yeah, exactly.
Thumbs up.
But getting into that parasympathetic or that relaxation mode as much as we possibly can is absolutely vital to healing.
Yeah.
And, the biggest thing that we know in the last 5 or 10 years about MS is it is just another chronic disease. It doesn't need to be this miserable neurodegenerative decline.
Yeah,
we're
really
always fighting that stress response.
We are.
So this is another super way.
Yeah, and it needs to be practiced daily, right? Like absolutely. It's no different. I say, an Olympian athlete, you go and practice every single day. In fact, I had an Olympian in my naturopathic school.
Right.
She won a gold medal in rowing, and she was a machine, like an amazing view of a human body.
Routine.
Exactly.
Right?
Morning, she would wake up and she would row at 6 a.m. and then she'd go row again like midway, before a clinical shift, she'd be in rowing. And so she was practicing.
But she was also eating at the same time and sleeping at the same time.
Right. Routine, which is all the things that we try to teach our patients, and, make sure that you get into routine and practicing. I call it practicing your parasympathetic, where Teri here, Dr. Teri says, stressed in the sympathetic, I say paused in the parasympathetic.
Nice.
So we got a new acronym.
There you go.
Put together. Excellent. I love it. But the other thing that is recent research, so, it reduces inflammation, number one. It moves the lymphatic, number two, right? gets the liver loving life and working well, and then it improves glutathione, and then it pauses you in the parasympathetic. But now even there's research that castor oil helps to break down biofilm. This is big, guys. Biofilm is the layer that's created by unhealthy yeast like Candida and not good bacteria like Clostridium.
Right.
And it's basically like a protective layer, right?
It's almost like a web. That catches all the junk.
Yeah.
Like the viruses, the bacteria, the parasites, and they hide in there.
They hide.
And this is really interesting in Lyme disease too.
Majorly,
right?
Lyme
because
disease.
Lyme can really hide out there.
Yes, and the biofilm is hard to break down, and there aren't very many substances that break it down. And the more virulent, so the stronger the bacteria or the virus or the yeast that's in your system, the stronger the biofilm becomes. So castor oil, where they've seen this, and this is research, seriously, like it's amazing what's coming out with in the research of castor oil, is that they tested castor oil in comparison to, chemical pharmaceuticals that break down biofilm.
Right.
And what they noticed that...
Are there any?
I mean, antibiotics will break down biofilm. It's one of the reasons why they'll give Lyme's patients, antibiotics.
Right.
But in terms of like oral cavity health, which is where the studies were done, they were comparing it to Polydent, which breaks down biofilm, right? Because you think your mouth is the biggest source of bacteria, right? And you're swallowing that bacteria all the time.
And like people who have like big plaque buildups, that's all biofilm. So you've got to look at your oral health too, and understand that if you've got a lot of plaque and you've got a lot of gingivitis or periodontal disease, that's a reflection of the inflammation that's happening in your body.
Absolutely.
As well,
it's all the same tube, like we're basically two tubes. We're an inside tube and an outside tube, right?
Like we're sisters from
another mother. We totally
know?
are. We think the same. Dr. Teri and I, we met, God, how many years ago now?
You were a kid.
I was a kid. I came and I followed with her. She's one of my mentors. And I learned from you so much, and it inspired me. Well, but this is I'm on purpose and on passion, and for me, and this is also why I love prescribing castor oil packs, is because it calms you down and quiets you in the parasympathetic state. It connects you to finding your purpose and owning who you are here in this world. So even if you're not happy, like you in your life, or you don't think you're doing the right things, taking those timeouts and doing that parasympathetic work with a pack,
and talking about parasympathetic too, we can get into nociceptors and pain relief,
which is huge in MS, right?
And like a lot of things that I have people do, people who have foot pain or foot, like the feet are too hot, the feet are too cold, putting on castor oil foot socks.
Absolutely.
And in the hands, right? Pain and
like neuropathies, right? That's where you're losing sensation in the hands. Like I've done that a lot with cancer patients after their chemotherapies, right? Because of the neuropathies that they would get in their certain drugs, right? The chemo our agents are really strong, so in the hands and the feet, and I would pack it as well too. So there was a question from Lorraine Marie: where do you place the oil pack for best results? So that's true. You can put it. So it depends on you, truly. But the traditional castor oil pack was placed from the middle, the xiphoid process, all the way back on the right hand side where your liver is. So to try to get that all over that liver, and then you're covering the large intestine, right? The ascending. You're getting the bit of the transverse. You're getting the pancreas,
the
gallbladder, the stomach, right? So you're really covering a bit of the adrenals and kidneys in the back. So you're really covering a variety of things, right?
You know what? I have to tell you, I just tell people to put it
belly
center.
That works too. Yeah. I mean, I think it just depends on what your practice has been. For me, I've always done it there to there, but there's definitely no harm to doing it in the center, because you're getting, there's so many lymphatic nodes going all the way up in the belly that you will get the pump in action either way.
And that whole xiphoid V, as I call it, right? You've got the tail of the pancreas, you've got that big lump of lymphatics, You've
everything.
got the tail of the liver.
The vagus nerve is pumping down into there, so you're going to hit that with the pack too. So really, as long as it's where you feel the most comfortable, and somewhere here on the abdomen, you want to be targeting all the lymphatic system and the liver and those big major organs that are working. And I mean, I prescribed it too. You know, like your way, you're hitting also the spleen.
Yeah, exactly.
So if I've had a patient who has more like immune problems or no spleen, I've said like, you know, move it over this way more, because then you'll get more of the spleen area. Yes, Lorraine, we are having fun. We're happy you're here joining us. We are, like I said, we're sisters from another mother.
That's right. And Rosalia's joined us, and Anne, welcome.
Thank you so much. Good to see you guys. But
so
yeah, it's the biofilm. I wanted to get back to the biofilm.
Yeah.
So what this means
because
is
that's really current stuff too, right?
Yeah.
That's super current, and it's we have to think about latent infection when we're talking about MS, right?
Yeah.
Any autoimmunity, those latent infections are what are the triggers and the perpetuators, right?
Exactly. They make the immune system not respond properly to invaders that come into our system. Because if you think about it, like we're set up for invaders. That's what our body is set up for.
That's
right?
what our immune system.
That's exactly it. Right? Yeah, and you know, so the gut, right? And whether it's good back, like we take in everything. And I'm always saying, you know, as the Queen of Thrones, that digestion isn't just about how you digest your food. It's also how you digest life. So the body can't tell what type of stressor it is, whether it's a latent infection stressor or if it's a
mother-in-law.
A mother-in-law, right? Yeah, it can't tell. Your body, your nervous system is all going to react the same way. And it's going to move into the stress state. You'll get a leaky gut. You'll have all those problems, right? You'll become more opportunistic for those bad infections to take hold.
Right.
So when you're doing the castor oil pack, you're improving that parasympathetic response. But now the next level is that the castor oil can also break down the biofilm. Now, this hasn't been necessarily researched, so we're extrapolating this. But you know, it's like it's kind of like
we're kind of ahead of the curve.
Exactly. Here, we always have been with these castor oil packs and these tools, right? We've always said, you know, they do these things, and now the research is catching up. So it's likely that if it breaks down biofilm in the oral mucosa, you know, it'll break it down when you do the pack. Because castor oil isn't just an emollient on top of the skin, right? The molecular weight, it goes in. Yeah, this is because of the shape of castor oil. If you look at castor oil, the actual like biochemistry of it, it's a typical triglyceride chain, right? You got a glycerol backbone and then the 3 triglyceride chain. 80% of those triglyceride chains are something called racinoleic acid, and that's what makes castor oil its special oil, the most unique vegetable oil. And why it's unique? There's an alcohol group on the 12th carbon, and that 12th carbon makes the oil.
Have you got this, Lorraine?
I know, this
12th
is
carbon,
12th carbon. So what it does is that the castor oil is flexible. Its molecular weight is lower than any other oil, and it can go in past the stratus corneum, so past the layer of epidermis, into the dermis, where all the circulation and lymphatic system is. So you can so it's almost like it's healing the gut from the outside in.
So you know a sneaky little thing I do too?
What?
Is I will apply things topically that I want, and then put the castor oil pack on top of it when I want that delivered. So like a lymphatic cream or a pain, you know, a topical for pain.
Love it.
And then I get sort of a double whammy there.
Yeah,
you know what I mean?
for sure. So, like frankincense oil. So many people are, as Boswellia as its Latin name.
Super anti-inflammatory.
That's right. And someone's asking what they joined a little bit late. That is Ann Pridle. So these castor oil packs, they help with a variety. They're basically a health promoting pack. One of my number one royal health practices, one of Dr. Teri's, you know, you got to be doing them. You know, it improves the liver function. It helps inflammation be reduced. It'll, you know, clear out hormones, make your bowels go to the bathroom a lot better. And it practices your relaxation.
Better sleep.
Yeah. Gets your
pain.
Reduced pain, gets your gut microbiome improved. So really there are so many things that it does. It's a practice that needs to be done.
And please go back once we're done here and listen to the whole thing from the beginning, because when we talk about healing as naturopathic doctors, it's not about take this pill. It's gonna keep you from having MS for the rest of your life, or even it's going to reduce your relapses. We want to, in fact, improve the quality of life, improve the integrity and the function of all of the systems in your body and how they work together, regardless of what the diagnosis is.
That's right.
Yeah. And overall, improve quality of life.
That's right. Yeah. And so we could take any, honestly, like if there's a patient who walks into my room and I am stumped, like I'm like, I need to think about this one through. I'm going to start right away with the castor oil pack because I know it'll probably clear. The reason I could be stumped could be because there's such a toxic muddle of things, and you know, they're so stressed out that they don't even know what their symptoms are, so they're not even communicating them properly. So castor oil pack to the rescue, right?
You know what? I, honest to God,
it's the same way you practice.
So when I first met this girl, I wanted to hire her on the spot.
I know,
but realized very quickly that she was a leader, a clinic owner, not her.
And I lived a little far away. It would have been a challenge for me to come on. So we've got Danielle here talking a little bit. Never placed it around just the center of my body, pubic bone and up.
Yeah.
MS can clog things up and have done a castor oil pack 3 days in a row. Nothing happened. And then drank a quarter cup of organic castor oil. Thank God the bathroom door was open. Yes, that's a lot of castor oil.
And Lorraine just asked, can it be ingested?
Yes, so it can. And then the typical dosage, though, a quarter cup is a lot, Danielle. So definitely I could see why you were running to the bathroom. Sure. And mobility is an issue sometimes for MS patients. So you got to be careful, right? So typically, like the Health Canada recommended dosage is that 1 to 3 tablespoons for an adult, and usually within a 6-hour period. I don't know, Danielle, what your experience was, but that it'll get your bowels moving faster. Yeah. So I used to recommend not recommend to take it orally, and but I've changed. Yeah, I've changed. Yeah, because you know, if there's a situation, a castor oil pack will take a while. You need to continue doing your castor oil packs.
Sort of to front load kind of.
Yeah, exactly. Gotcha. So if there's, you know, because you've got to think in MS, there's also a huge component of, you know, backing up of the bowels and then the toxins coming back in and affecting the nervous system. Yeah. So why not let's clear the bowels out
as quickly as we can
and train those bowels. Because the castor oil topically, there's also great research about, you know, the structure that we were talking about the castor oil, that racinoleic acid with the, you know, the alcohol group on the 12th carbon looks very much like a natural anti-inflammatory, but a natural stimulator of movement of our smooth muscles, PGE3, the prostaglandin E3.
Nice.
So the castor oil will attach onto those receptors in the intestine and the uterus too, and will make and will make them move.
And for people that have crampy guts or bloaty guts or you know, all of that stuff, right?
It just helps to like smooth it out and help things to move the way nature intended, right? In a natural way. Exactly. So it's just such an amazing tool, and I never want us ever to stop using it. And in fact, you know, it used to be in everybody's medicine cabinet. There's so many cultures, like take it back 100 years ago. Castor oil was in every single medicine cabinet, and people would be in a habit, you know, maybe to take it once a week to get things moving, because, you know, the gut is health. If you're if you're digesting well, you're digesting your life well. Everything is well, right? And if you're moving well, that's important too.
Super important.
Right? Yeah.
I just wanted to giggle. My mother, and I'm sure a lot of people's mothers,
would drink it back all the time. To
deliver a baby.
Oh yes, induction.
So, right. So so Daniel, back to, you know, you can actually get some serious cramps going, you know, so.
And yes, Lorraine, castor oil packs, we recommend them daily. How long do you, I recommend them typically anywhere from an hour. I love doing them overnight because they're so relaxing. Your sleep is amazing. But there's some days, like my schedule can be a bit varied. So, you know, sometimes I'll have a lot of time in the daytime and then I work late into the nighttime and I don't want to come home and put on the pack. So then what I do is I'll actually use my pack and I'll put it on my liver and I'll actually go work out, because there's all these tools now in the marketplace that you can use that'll help you to, you know, do a pack easily. And so just like this is an example of a pack that has straps on it, and I'll just wear it, put my oil on it, wear it, and then wrap it around my body, and then I'll sometimes go on the treadmill or I'll run around. Right?
So you're being super modest.
Yeah.
But this is your product.
This is my product. Okay. Yeah.
So this is not an infomercial.
No.
That's how committed she is. She started a company.
Exactly. So, and I did it easily because for me, it was what I noticed, what stopped me, because I heard about castor oil packs even before I'd become a naturopathic doctor at a health food store, because at the time I was suffering from anxiety and IBS, right? For me. And so everyone was saying to me, do a castor oil. But the way to do it, a castor oil pack, was insane before, right? It was like, soak a flannel.
Double boiler. It's like, I always tell people, if you want to get really confused, Google it. Because you'll find 5,000 different ways to do a castor oil pack. But I'm telling you, I've got a video on waterdownclinic.com. under the resources, teaches you exactly how to do it.
Yeah, and if you want,
should we run through that?
Yeah, sure. So for my pack, I've got a video too. We can add that link at the end if you want. Yeah. And so for now, what I did from the 10-12 steps it took before to do a castor oil pack, this is my new and improved version of the castor oil pack. All you literally do, it's impermeable, so it actually has this coating, which is very healthy. It's non-chemical, pulled the same material that's used for organic reusable baby diapers, so safe for a baby. That you actually just pour 2 to 4 tablespoons of castor oil, you blot it, and you put it on the body,
and that's all.
And you attach it, and that's it.
And what I tell people is, it's eventually going to saturate the whole thing.
So eventually it does, but it won't still be impermeable. It won't go through. But so I will wash mine probably after every 10 to 15 treatments or so. Sometimes longer. Just depends on how much. You don't have to wash it. That's
because it's not pulling anything out.
It's not. Yeah,
your body's pulling
the castor oil in and coming out. So you don't have to wash it. But some people just, what I found in my practice, they're like, oh, that darn thing's so heavy, I just can't, so for comfort. So I just say, if you do want to wash it, soak it in hot water and baking soda overnight. Baking soda will pull out the castor oil, and then the next morning you just hand wash it quickly and lay it flat to dry. So super easy. My Queen of Thrones castor oil pack.
and people always ask me, what do you do it? How do you store it? I literally, I said to Marisol, I brought in a prop. This is my castor oil pack.
That's right. Yeah.
That's just a regular old Pyrex dish with a lid on it.
Yeah, and that's how you store it. Nice and easy, and don't make it complicated, but just make it simple for health practice. So that's, that, and, it took me getting really, really sick in that 3rd year to actually create my first pack.
And people underestimate the power of simple self-care.
Yeah.
I want you to think about this like you wouldn't leave the house without brushing your teeth.
Yeah, exactly.
So don't finish your day without doing your castor oil.
That's right.
You can do it. I tell people, if you have time to watch TV, you've got time to do your
if you've got time to cook dinner now, with my pack as an example, you
can
just attach it and just make dinner. This one's yours. But it's like, and as naturopathic doctors, our job too, and that's why we're well-renowned doctors, for the reason that we make things simple for our patients.
Exactly.
And those things, like necessity is the creator of invention, right? It created invention from those things. And for me, I wanted it to be a practice for me, so I selfishly made it for me. And then I'm like, well, everybody needs this. We can't do that.
So it's not about what you take; it's what you do, right? So we want to balance.
Yeah. Right. Yeah, Eric Swenson, thanks for joining us. Well, make sure to take a look at the entire, we're talking about castor oil packs.
Yeah. And we're just finishing up.
Yeah. So we won't repeat it all, but we do want you to watch the whole video. Does it need to be stored in an airtight container?
Nope.
No, because castor oil on its own is an antimicrobial. It's natural. It, breaks down that biofilm.
Right.
So you don't need to. It's fine.
Exquisitely stable. It does not go rancid. It doesn't even need refrigeration.
Yeah. The only thing we want to make sure of is it doesn't touch clothing or things or tapestry or beautiful materials you have in your home, because castor oil stains.
So you don't want to do this in your favorite negligee.
Yeah. Don't do that. Don't do that. That's not a good idea. A couple of packs are great, though. Me and my husband both do our packs, and we'll go to bed. We're all wrapped up in our castor.
Romantic.
I know. Well, we're self-caring. We're on the longevity plan.
Exactly. Right.
That's our goal.
It is a thick, sticky oil that stinks. So you don't want it touching fabric. I love that
it's easy to pack,
because my pack is an older pack, and it doesn't have that permeable back.
They're my old pack,
so I just put my hot water bottle over top of it, and then a towel so it doesn't touch anything.
Yeah, so this will prevent all that, as long as people don't. I mean, and we can put a link up for them to, if people want to purchase it, you can you can get them through Teri, through the clinic, and of course, if you did, because there's a seam, if you do put the oil in the seam, then there's holes there, obviously, so then it will go to the other side. But there's enough room here where you could put this all over your body. And I even say, shoulder pain, like you're having some shoulder pain, so you're going to be doing a pack like this tonight, right?
Or even because it's my rhomboids, I like to just flip it over.
That's perfect.
Oh my gosh. Like this is going to be, I'm so sleeping with this
tonight. Castor oil packs, they saved my neck in naturopathic school from all the hunch and over constantly.
And you know what?
Life practices.
No kidding. And I mean, I used it everywhere. I use it all the time for people with coughs.
Yeah.
And I even get them to put a couple of drops of lavender or eucalyptus essential oil. If they're nervous, the lavender essential oil on the pack to the abdomen, because you've got that parasympathetic connection, right?
That's amazing. Yeah. What I love about
around joints, like you can wrap your castor oil pack around a joint.
Yeah. You know what I love about gloves. You're creative. You don't do anything the normal way. Do you know what I mean? Which is good. That's what you want in a naturopathic doctor. You want someone who is, outside of the box. And I teach at the naturopathic college, the castor oil pack course now, which is actually a 6 to 7 hour course. Can you believe this? Like there's more. We're going to get together and we're going to do another one just on castor oil for skin conditions and such. So we'll share that later. But you'd be amazed like at how much, research there is. And I always tell the students at the end of the class, I go, be creative. Do these things like what Dr. Teri's doing. Like she's taking the oils and making them go into the body better. And, if, she's working with your personal constitution. And those are very important things. Right?
So can't say it enough.
Yeah.
Thank you so much for being here.
Anytime. Love it.
This is one of the most important things you can do to decrease inflammation, regulate your immune system, reduce stress and anxiety, move constipation, reduce pain. Have I missed anything? If you have dry eyes, you can put a little bit in a dropper bottle and put 1 drop in each eye before you go to bed. Remember, it's an oil, so you don't want it
foggy.
But
and there's more. I mean, Teri, I have an online program. If anyone I can share that link to wants to know about it. Like there's about 101 uses of castor oil for like skin conditions, health and beauty, like all these things. And everyone should know about these things.
You know what? I have a couple of patients that do the oil cleansing of acne with it,
to wash your face. Like you simply take like a hot cloth, you open up your pores, and then you put castor oil on your hand and you blot your face, and then you take the cloth afterwards.
I do that as a face pack on the weekend. Like if I'm not going out, I'll just slather it all over and let the skin soak in.
Absolutely. It is
eardrops for ear infection.
Everything. I mean, I look at this castor oil. The castor oil plant it's called the palm of Christ. If you look at the leaves of the tree, they look like the palm of Christ. But if you look at the bean actually, the protein of the bean is a biological warfare. It can actually kill the body. But the oil is the most healthiest thing in the world that is absolutely healing.
And it's that duality
and yang.
Right? That Russian spy and his daughter who were just in England.
It was ricin, which is from castor oil bean, not the oil.
That's right. They were an assassination attempt. The authorities couldn't figure out what it was, and it was a little pellet that had been dipped in ricin, and they had been shot in the leg with it.
Yeah, and I mean, so if you look at that in nature, like the thing that could kill us, it has the most potential to heal us. And if you ever are worried, the oil does not have any of that, so it will not hurt you at all, which is why I wanted to end with that, because people often ask me that question. They're like, isn't it, like I saw it on CSI, and they were using it to like, so it's not, the oil has none of that. The oil is 100% healing, nurturing, bringing out that healing power of nature in your body. So for everybody.
There you go.
Awesome.
So first do no harm, right?
First do no harm. Okay. It's our principle as naturopathic doctors. It's great.
Thank you so much.
Thank you so much for having me. Oh, it's wonderful.
And if you've just joined us, so you've missed most of this, sorry, tripping over my tongue, please go back and watch it from the beginning. And every time that you get sloppy with your castor oil, go back and remind yourself again. Watch the video again, okay?
And Dave, just to answer your question quickly, we did talk about it being used for inflamed, tingly feet and legs, the castor oil.
Absolutely.
Yeah, so just go back and you'll get, absolutely. Yeah. And thanks, Lorraine, for your nice comments. And we're hoping we want to give you as much as we can of ourselves, because we're here to serve you.
Yeah.
Yeah.
Okay, one last thing. Danielle has written another big one. Dave, one trick I did was using 2 tubs big enough for both feet. One cold water, one warm water. That is, and you know what, Daniel, you've posted this before, and that's awesome. And that is a basic hydrotherapy technique. And really, castor oil pack belongs to the hydrotherapy family.
Oh, absolutely. Right? Yeah. And I mean, those are all healing power of nature. And how can you do these things at home, right? And these are the keys. And this is why we're teaching you. And I think we've converted a believer, Lorraine Marie. We're excited to get you using the castor oil packs. That's great. I hope everyone who's joined us today does.
Okay. Yeah. Good night.
Thanks so much.
Bye-bye.